Hi, I'm Dr. Nicole Bain, and I'm sitting here on this beautiful afternoon enjoying the sunshine and ocean next to our office. But I wanted to talk a little bit about what makes our practice different and special, besides the proximity to the ocean, which is wonderful. One of the things we pride ourselves on is conservative biomimetic dentistry. So the term holistic is whole body. But if you really want to boil down just to what dentistry is all about, most people want to avoid a root canal. They want to avoid having aggressive dentistry. They want to avoid being oversold. We've been interviewing a lot of dentists lately to look for an extra dentist to join our team. And I've also been doing this about 20 years, and I've worked in dozens of offices in the past 2 decades. And one thing that most dentists do is, I believe, they over-treatment plan crowns, posts, and root canals. There's some really wonderful things in the Academy of Biomimetic Dentistry. And what that means, biomimetics, is trying to mimic the flexure of enamel. So almost all of our dental materials are far inferior to what we were God-given, which is enamel and dentin, and the dentino-enamel junction and the dentino-enamel complex. So what causes cracks? Clenching, grinding, big, huge mercury fillings are very common to unsupport the enamel and cause them to crack and break. And we've always just been told, put a crown over it. But what makes biomimetics is that we can do large resins or resin reinforced restorations that can reinforce and support the crack without grinding the tooth down and out removing the most strong part of the tooth, which is the enamel. So we've incorporated something called Ribond into our technique. And if you look it up, it's essentially a matrix of porcelain woven fibers that we can reinforce and layer in above the pulp or above a fracture to protect it. So it distributes the load easily in the same way that a crown would, but instead of grinding the whole tooth down, it mimics the flexural strength of the enamel, and it supports the cusps or anything we're bonding into, so that we're not doing the typical pulling and torque for the excessive forces that exist in the mouth, in which most dental materials may fail underneath. So come check us out. You want something more conservative done to your tooth? We do second opinions all the time. And what our most popular procedure is patients scheduling for something that they know is going to be conservative, that will last them a really long time. So we're happy to see you anytime here at Moonlight Beach Dental.